Here to give a Washington Health Trust update. I like to start with this quote from Dr. Martin Luther King Jr. Of all forms of injustice, inequality in health is the most shocking and inhumane because it often results in physical death. Just to kind of center ourselves on why we're all here today. Here's what I hope to cover. Do a brief introduction of myself and Whole Washington, a little bit about our efforts with the Healthcare as a Human Right Coalition, talk a little bit about the 2025 legislative session review, and then where the Washington State Washington Health Trust legislation is right now and our opportunities to influence the next version that goes in. And your opportunity, hopefully, to get involved in participating in that language. And then Whole Washington's really pivoting after this legislative session into our initiative strategy. So I'll talk a bit about that, a bit about how you can help. And then I would love to have a discussion about how Whole Washington can best involve providers in this work. We've done a ton of outreach. I'll talk a little bit about the different targeted communities we've outreached. And I think the healthcare community is our next target. So I'll talk a little bit about that. I'm open to questions as the presentation goes along. I typically can't see hands, but if folks want to come off mute and interrupt me, I'm totally okay with that. I like to have the interaction. So introduce myself again. I am a dues-paying member of both Washington State Nurses Association and National Nurses United. I believe that strong workplace democracy creates strong democracy in our country. So even though my day job is not represented, I pay dues, put my money where my mouth is. I think it's important to do that. I co-chair the HICR Labor Table. It's a new development. We'll talk a little bit about that later in the slides. I also was on WSNA's Legislative Health Policy Council this most recent year for the first time. Huge learning curve. It was very exciting to see WSNA pass all of their primary bills on their legislative agenda, hoping to pull them deeper into the healthcare justice movement with my participation there. And then I've been with Whole Washington since 2016, 2017. I collected a whole 7 signatures on our first initiative, and then have just kind of grown in my knowledge and capacity since then. That's my email address if you ever want to get in touch with me. A little bit about Whole Washington. We are a nonpartisan 501c4, and then we also have a 501c3 fiscal host through Sustainable Seattle. We are the authors of the Washington Health Trust. We are the only universal healthcare group actively building a ballot initiative campaign, and that's the get it done right now strategy. The legislature is going to take forever. It's like Sisyphus rolling a ball up a hill. It's painful, necessary work, but I do believe there's ways to get it done faster. So I will talk about the ballot initiative campaign. We are proud members of the Healthcare as a Human Right Coalition, very active, involved. We do encourage Whole Washington volunteers to get involved in a number of different ways in the coalition. I think that we can do this together. We can do this together. We can't do it individually. Our focus has been largely on movement building over the last 6 years at least. We've been heavy getting out into the community. Signature gathering kind of leads those efforts. We've had 3 initiative attempts over the last decade. We've done a ton of universal healthcare town halls. We stole that idea from a successful ballot initiative campaign in Michigan. We did like 23 town halls over last spring and summer and have since done at least 40, not counting our virtual town halls. We host typically monthly online. We are developing regional and county teams to participate and create local events. We do partner with other organizations for their events to be successful. Again, that movement building, we're doing this all together. All of the social justice movements have intersectionality, and we've been trying really hard to be good partners in those spaces. We've been recruiting public testimony for the Universal Healthcare Commission. Andre put together spectacular panels of testimony for legislation this last legislative session. And then developing partnerships. We did a whole bunch of demand access, healthcare, not warfare town halls last summer with Washington Physicians for Social Responsibility. Very interested in those kinds of partnerships for this coming summer season. We've got something in the works with HICR and Washington CAN for Seattle. So far, I've talked Nathan into one event for sure. I'd love to do kind of a series around King County if we can get folks interested in that work. We've also co-hosted several rallies and summits with HICR that really resulted in passing a resolution through the Washington State Labor Council Convention in July. Again, not work we could have done by ourselves. This coalition building and movement building is incredibly important for the success for all of us. And then getting invited onto agendas like this. We've done Rotary events and Chamber of Commerce, and we did Utopia Climate Summit and all kinds of different organizations around the state that are working on different kinds of healthcare justice or social justice movements. So happy to be in this space with some really impressive organizations doing this kind of work. Here's a little bit of details about that Washington State Labor Council resolution. It was an impressive turnout. Over 300 labor delegates voted and only one abstained, and there were very few cards raised in opposition. I know there's been a ton of work before this, kind of paving the path, and that HICR labor table is really intended to implement this resolution that we passed. So making sure that the whereas clauses are actually followed through on. So if you're interested, I know there's lots of physicians getting involved with unions now because of that struggle we talked about, just getting your work done. So if you're associated with a union or not and want to do this work with us, the HICR Labor Table is a great place to do this in solidarity. So 25-26 legislative session, efforts and outcomes. The Washington Health Trust is the primary gold star, our primary bill that we're trying to make through. We're not having huge successes here with movement in the legislature, but things that we've set our eyes on, we've succeeded. So in 2025, we really set our eyes on increasing the number of co-sponsors on the Senate bill and also getting a companion bill in the House, and we were successful in both of those pieces. So you can see the numbers on the slide. I'm not going to read those to you, but super impressive efforts on behalf of our volunteer teams, connecting with their local representatives, doing an on-site, on-campus lobby day, really getting a number of new co-sponsors involved in this legislation is very impressive. Despite having a record number of co-sponsors and a companion bill in the House, we still did not see committee hearings for the Washington Health Trust bill in 25 or 26. It's really the prerogative of the Healthcare Committee chair to pull our bill forward. We did a ton of work in Senator Annette Cleveland's district. We hosted a series of events last April and really made sure that her constituents knew how important their voices were. And we made some progress with Annette Cleveland this last legislative session. We have a Dan Bernofsky problem is what we found out as our another bill I'll talk about in a minute moved through the Senate and did not make it it was not given a hearing in the House. We have found out, rumor is that Dan Bernofsky is stepping down, but whoever takes his place, we do plan to host that same kind of community effort wherever that person is residing so that we can get their constituency just as involved as the 49th district. Another effort this last year, Senator Hasegawa convened a stakeholders group for universal healthcare stakeholders. The intent was to influence the Washington Health Trust legislation so that we could put something forward that had a bigger coalition backing. The timeline proved to be too challenging. So they very quickly kind of pivoted to what can we get done in a 26 legislative session? It's short, there's no budget, there's going to be all kinds of challenges. So it did spin a little bit, but those stakeholder meetings will resume. The next one's scheduled for April 22nd. With, again, the primary goal of creating a version of the Washington Health Trust that can be reintroduced with a very large coalition backing so that it might make it a little farther than I've described. All HICR members are encouraged to participate. If you folks are interested in being at that table, please do email Andre. And I'll get these slides to David so he can include them in the report out. This is what the stakeholder table looks like for Senator Hasegawa's meeting right now. There are voices missing here. We'd love to see more participation. There are a number of bills that did come out of that stakeholder work group, if you will, that we see as kind of stepping stones or building blocks towards the Washington Health Trust. Medicaid deprivatization was really popular amongst our group. It had zero co-sponsors and went absolutely nowhere. We do know that PNHP is supportive of this Medicaid deprivatization. Really appreciate the white paper you guys put together. And just if you don't know already, the Washington State Medical Association did pass a resolution in favor of Medicaid deprivatization. Resolution's just a piece of paper unless somebody pushes them to do something with it, though. So this is, I think, an opportunity for us to maybe collaborate around getting this information out to the public. So super interested in ideas after this meeting. We also looked at the other bills around expanding eligibility of Medicaid. There was a single payer trigger bill that went pretty far, commissions and deliverables deadlines, knowing that the Universal Healthcare Commission has kind of been spinning their wheels for the last 3 or 4 years, and understanding that some deliverables and deadlines would really be supportive of getting more effective work out of that commission. And then the healthcare as a human right constitutional resolution that did get a hearing but didn't go anywhere. So we'll talk about that. These are the bills that had no hearings. We did have like a throw spaghetti against the wall and see what sticks kind of approach with the context of this last legislative session. Again, very little time, no money. So the good news is that most of these bills did get fiscal notes assigned to them so that we do know what the state budget implications might be for some of these strategies. And then the Senate Joint Resolution, Healthcare is a Human Right, a constitutional amendment was based off of a similar Oregon Measure 111. Really defining the obligation of the state to ensure that every resident of Washington has access to cost-effective, clinically appropriate, and affordable health care as a human right. This had an incredible testimony. There was a panel of advocates who just delivered their heart to the legislature. There were approximately 3,000 people signed in pro. This was a huge effort on behalf of whole Washington, but also the Healthcare is a Human Right Coalition. This did pass through Health Long-Term Care. It had a hearing in Ways and Means, but it was not pulled through to the floor through rules. So it made some progress being first year implemented or first year introduced, and gave us excellent like social media tidbits to share online. So really very impressed with the outcomes here, even though it didn't pass. Senate Bill 5947 was a single payer trigger bill based off of a similar Maine Public Law 391. It would trigger the federal government. If the federal government did something, then Washington State would go first to implement. Very similar to the trigger bills that were on the books when Roe versus Wade fell, except much better in my opinion. This really was ready for amendments, thanks to Vicki Lowe, who does chair that Universal Healthcare Commission. Lots of successes in this space as well. Again, powerful testimonies. I've got the YouTube link there. If folks want to hear some of those or use them for something, feel free. Another impressive level of pro support. This one made it all the way through the Senate. It was passed unanimously through the Democratic part of the Senate. No's on the Republican side, which is too bad. I think this really should be bipartisan, nonpartisan legislation, but it was not given a hearing on the House healthcare side. So again, Dan Bernofsky, a problem, I think. We also noted that he said no to the millionaire's tax. Thomas did a deep dive into his campaign contributions, and there are some concerning industry money in that space. So things to know. So other updates that we thought were important coming out of this legislative session, a reminder that we do plan to reintroduce the Washington Health Trust. We do plan to continue those stakeholder meetings with Senator Hasegawa. Andre's been doing a great job leading those and trying to keep folks engaged, get materials out ahead of time so people can participate meaningfully in that process. And then we requested a joint work session. That request was submitted in 2025 with the hope that they would review the Washington Health Trust between the 25-26 legislative session and have an opportunity to review the bill, talk about the bill, collect some public testimony without the pressure of a vote at the end. That didn't happen. We're still pushing on this request. It would be great if others would also ask for this, especially as we're working on, evolving that language for reintroduction. Some successes here. Senate Joint Memorial 8004 in favor of federal waivers and the State-Based Universal Healthcare Act passed in 2025. And then followed up in 26, we passed a similar resolution in favor of Medicare deprivatization. I know David Loud's super excited about that one. We'd love to see the PEB expansion bill reintroduced. I think the PEB-SEB consolidation bill did not have union support, so that tells a story about where we need to put some more efforts. These are pieces that are foundational for a single payer type or a Washington Health Trust type bill. We see these as stepping stones, right? Building blocks towards something bigger. So knowing that the unions were not fully on board with that consolidation of their contract is something we need to concern ourselves about as we look at building the Washington Health Trust. Public bank bill is something that Senator Hasegawa has championed as well. If we're going to put our money in a public trust for healthcare, it makes sense that that money would also be managed by a public bank. It would save Washington money and put that money to the best uses. We did see U.S. Representative Randall sign on as a co-sponsor for that State-Based Universal Healthcare Act at the federal level, and then Representative Sean Scott signed National Nurses United Patients Over Profits Pledge. I linked the pledge there. I'm not going to dive too much into it, but if you're interested in more information, it's basically saying I'm not going to take a bunch of money from the medical industrial complex. Important dates and deadlines. David mentioned that this is a long session. Here are the dates of those sessions. I highlighted 12/1 for the bill pre-filing. That's when our language for the Washington Health Trust legislative version needs to be ready to go for reintroduction into the legislature. I feel like I should pause and ask if there are any questions before I move on to the next bit. Any questions about legislative session or how things went? Okay, I'll keep going.
I have one question. Sorry.
Sure, go for it.
I was just briefly, I was at the 43rd legislative meeting last night, and Nicole Macri mentioned specifically what happened that Dan Bernowski wouldn't she tried to get him to move this bill or at least have it but it sounds like you're saying he's stepping down. I thought Nicole Macri was vice chair, but maybe she's not. So
that's what we're hearing. Healthcare for All Washington tends to be a little bit closer to the legislative folks than we are. We're developing those relationships, but they've been doing this work a lot longer than we have, and they have some really strong relationships at the legislature. And so Ronnie shared at the Hicker retreat that Dan Bernowski is rumored to be stepping down. I don't think we know exactly how they're going to reassign that chair position. I know we've asked. Pam, who's in the room, has a very close relationship with Jenkins and is trying to, see if she can get any insight from Speaker Jenkins about how that might look, but I don't think we know yet.
Well, it'd be nice if it was Nicole Macri. It sounds like she's very supportive.
It would be. That would be fantastic. We also, Representative Partially introduced the companion bill in the House. So I know she's fairly new to the legislature, but that would also be fantastic for us. Yeah, thanks for your question. Anyone else?
Yeah, I have a question. This is Dana Audio. You mentioned that you were a member of the Washington State Nurses Association. I used to be a member when I was working as a nurse or a nurse practitioner. And I had approached them years ago when I was a member of Healthcare for All Washington about support for the Washington Health Security Trust, which is what what Healthcare for All Washington was pushing. And I I lobbied with WSNA to try to get their support, but they wouldn't move. I'm wondering where they are now in support of your Washington Health Trust bill.
Yeah, that's a great question. So Catherine and I have attended the WSNA convention. They host every 4 years. The last two of them, we were there. 5 years ago now, I think we were able to pass a resolution in support of the Senate Joint Memorial that passed. And I know that they have language in their platform, so to speak, around support for healthcare justice and universal healthcare and those kinds of things. But they are not yet as active as I would like to see them in the advocacy work here. We did attempt to pass a resolution more directly in support of the Washington Health Trust 3 years ago now. And it was pulled from the floor. The executive board said that they were going to review it and go from there, kind of thing. We haven't seen much progress. I again,
That's what they told me. That's what they told me about 15 years ago, too. So
yeah, and I don't know what the holdup is. I know that Jessica Hoffey, who's their political director, is supportive personally. Justin Gill, the president, super supportive personally. I'm not quite sure what the holdup is for getting the organization more involved in the advocacy. What we hear, okay, so I participated in the Legislative Health Policy Council, and they're focused a lot on what they can get done in the legislative session, like what are the wins that they can move through, and they were successful getting all three of their priority bills through. But that doesn't equate with taking a big risk like this, right? So I'm going to keep working on them. I plan to attend the WSNA Leadership Conference in Wenatchee at the end of April, and I plan to come prepared with lit that promotes Whole Washington and the Hicker Labor Table, as well as we met Dr. Despain through a Faith Action Network event we did out there last summer. And him and his wife are pulling together a couple of events geared towards providers and small businesses while I'm out there. So it'll be busy couple of days for me, but really making sure that the WSNA nurses that are involved in leadership attending that conference know that we're out here and we're doing this work, and then hosting the local event to get local folks involved in this work there too. So I think it's going to take that kind of groundswell from WSNA members to pull the org in. And I think that's true of any union, really.
well, thank you, Carey.
Yeah. Thanks for your question. Okay, so some more about the Washington Health Trust. This is a bit about the history of, it's not a comprehensive history. You guys have all lived this history in ways I haven't. So if I'm missing something key, I apologize. But in the 90s, we were close, is what I understand. The Health Services Act was signed into law in 1993, and then the government who was running Washington State changed, and by 95, most of that was repealed. Healthcare for All Washington ran the Washington Health Securities Trust as a ballot initiative, and then introduced it as legislation when that ballot initiative wasn't successful. That's very similar to how Whole Washington started in 2018 with our first ballot initiative, and then again introducing that into the legislation. We built our bill off of Healthcare for All Washington's bill. Super thankful for all the work that's come before us. Also super do not want to be doing this 30 years from now, guys. So like this sense of urgency is real for me. When I attended the Hicker retreat and the legislative process feels like it's going to take another 30 years. And I really feel like we just can't wait that long. No offense to either of the Davids, but what I said to Nathan was like, neither of the Davids are still going to be here by then. We just can't wait that long. Okay, so then the Universal Healthcare Commission came into place. We've done a ton of work through the commission. Andre's done some presentations through the commission. We've recruited all kinds of testimony for the commission, both to the commission meetings and through FTAC. Riley, who is a whole Washington volunteer, is co-chairing Hicker's Hucks committee that follows that commission and prepares. So they keep a close eye on the agenda and they coordinate testimony to make sure it's on topic and meaningful and hopefully pushing that commission to do better work faster. So far, it's not come out with clear legislation for a universal system. And there's a little bit of finger pointing, in my opinion. The legislature says, hey, we made that commission. They're supposed to be working on this. And the commission says, we are not legislators. They're supposed to be working on this. And in the meantime, nothing's getting done. So there's my personal vent. I think that's about it. So we're looking at the cost of inaction. I love this slide. You can see in 1993, we're paying over $5,000 per person in Washington, in the US anyway, for healthcare. And then as time goes on, these costs just keep getting higher, right? This taps out at 2023. We know that these costs just keep getting worse and will continue to get worse unless we fundamentally change the way that we're operating the system. Gerald Friedman expected this to double over the next decade, increasing by over 70 billion, rising from 14% of the state output to 17% of the state output. This is Washington state-based. Gerald Friedman did a study for us in 2018. Okay, Washington Health Trust is real legislation. I mentioned that we built our bill off of the Washington Health Security Trust bill. It's not exactly the same. We've adjusted it, designed to align with the federal Medicare for All bill. At one point was vetted through the Washington Employment Security Department and the Department of Revenue to make sure it was fiscally sound. We did steal language from the Healthy San Francisco model because ERISA comes up a lot as a barrier. And so far, the Healthy San Francisco model has stood up to legal challenges around ERISA. A lot of that has to do with the opt-in model. So we're not forcing people to join the Washington Health Trust, but we are saying you have to cover healthcare, and here's an option that's publicly funded and way cheaper, better coverage than any insurance company is going to provide. It builds on top of the ACA, Medicare, Medicaid. There are ways that it supplements Veterans Affairs and Indian Health Services. We did have a legal review, a tribal legal review done a couple years ago now, very favorable. We're not allowed to post that publicly, but if anybody's involved with tribal healthcare policy folks, we do have permission to share that legal review in those circles. It is a universal healthcare financing bill, so it's just paying the bills. It doesn't change how doctors and hospitals operate. They remain private practices as much as they are today. Public insurance plan for Washingtonians is really what it is. So we're kicking the for-profit insurance companies out and creating an option, a true public option that's not tied to wages or income in the way that Cascade Care is. Other countries with similar systems include Canada, Taiwan, South Korea. You guys talked earlier about Canada. Originally, the Canadian system started in a single province. So I think a lot of state-based single-payer advocates talk about being the Saskatchewan of the US. We'd love to go first. I'd love it if Oregon goes first. I don't care who goes first, because I think once one state moves in, then we'll have a domino effect across the country, because it will prove itself to work pretty quickly. The Washington Health Trust would be available to all Washington residents. There is some language in the bill around non-residents who work in Washington would still be covered. That question came up at a town hall the other day because of the telework situation we're all in. It would cover folks who live in Washington but are vacationing out of state. It does not cover out of country. It would provide a comprehensive coverage. Its essential benefits plan needs to be developed, built off of, the good union benefits type vision. It does include a transition plan. So I mentioned Andre spoke at the Universal Healthcare Commission. He talked about kind of a 5-year transition plan. But it could go faster if the state puts more resources to it. It could take longer if they don't. But that's the vision is really over a 5-year plan. Nothing happens overnight, but we got to start somewhere and get the trust established. And it's fully paid for through public funding. Here's what it would cover. The way it's written right now, there's no deductibles, no copays, no premiums. With the federal cuts coming, there are some discussions around how do we fund this now that, Medicare, Medicaid is kind of being gutted. So there are some talks of potentially bringing the premium back. But there would be no networks. Networks are insurance company contract driven, so we get rid of that piece. There would be no denials for medically necessary care. It really puts the patient and the provider back in the center of these decision-making processes. The idea is that there's no out-of-pocket spending at the time of service, no surprise bills. Ambulances are covered. Dental, vision, hearing, supplements for Medicare. So, it works really well in conjunction with existing programs. I thought this might be important to mention in a PNHP crowd is the different boards that are established by the Washington Health Trust. There's the board that administers the trust, makes ongoing decisions as, healthcare evolves and technology evolves. There's a citizens oversight board, which I think is really important when you're spending public money, that the public has oversight into those processes. And then there's a physician provider board that essentially allows for a collective bargaining for rates of healthcare services paid for by the trust. One, it creates transparency. The Washington state says this is how much we pay for a colonoscopy. Doesn't matter where you are in Washington or, what healthcare entity is billing. So providers and whoever patients can know what the cost of those services are. They can plan their businesses around what their payments are going to be. And then there's not that huge administrative burden of fighting with the insurance company to get paid. I think we'll see a lot of benefits around the decrease of administrative burden here. And at the same time, it saves money. So I mentioned Gerald Friedman did a couple of studies for us. The Washington Healthcare Authority also did a study through the work group that preceded the commission. All of these studies show billions of dollars in annual savings for Washington, even with expanded coverage covering all of residents of Washington and additional services in most cases. So it's really a no-brainer for me. But the studies are linked if you want to dive into the details. The website is fantastic. We have a great FAQ section. The full text of the bill is available. We developed a one-pager that was really geared towards having conversations with legislators. That's the one-pager on screen there. We also have a small business one-pager, and we're working on a healthcare professional one-pager. So what is it that doctors and nurses and nurse practitioners want to know about? How can we pull them into this? So I would love to have that conversation again at the end here. I teased this. Given the federal government plans to decimate funding for Medicare and Medicaid, what is Washington's new plan on how to fund the Washington Health Trust? So how we pay for it is one of the main questions we get constantly. On the left-hand side of your screen is what the current legislation says about how we fund the Washington Health Trust bill. It's primarily a payroll tax, payroll assessment, if you don't want to use the word tax. we developed kind of a sliding scale for employers based on the size of the business because of our conversations in communities with small business owners, really telling us that not only can they not afford healthcare for their employers, but for their employees, but most of them can't even afford healthcare for themselves. So we created some tiered language around the size of the business. Sole proprietors would pay 2% of their gross income. The first 15,000 is not taxed. It's really intended to get, gig workers and those kinds of folks an affordable option for healthcare. Currently, there is a capital gains tax. We've built it to kind of straddle the other capital gains tax that was introduced since the Washington Health Trust language. The intent of this is not to be a middle-class tax burden. It's really intended to get at folks that are making money in ways that are not traditional salaried employment kind of work. And there's some hit pieces out there about the Washington Health Trust that they claim that we're coming after your houses and we're coming after your retirement. Both of those things are exempt. There's a list of exemptions that, the capital gains on certain things would not be taxed in order to support the Washington Health Trust. Because of all the changes at the Washington state level and all the changes at the federal level, we did join the Balance Our Tax Code Coalition, and we are working with them on additional strategies on how to fund the Washington Health Trust. So this is what it is right now. We do anticipate there will be some changes for the 2027 version that's introduced. Do we need to bring back the premium, for instance? Is there an adjustment to the capital gains tax? Is there something else we want to consider? Andre's put together a survey for that stakeholders meeting that includes kind of a myriad of options for folks to consider in this space. So this actually is language I stole from Trish, who's here tonight in our Slack, around why physicians or providers should support the Washington Health Trust. I would love for feedback in this space. Does not have to be tonight, but are these the right talking points as we approach providers? If we armed patients with one-pagers to go talk to your doctor about universal health care, are these the things that would help start a conversation in that space? Is there something missing? Is this, which ones of these are really the most important? So I'm not going to read this slide to you. Again, I mentioned I'll send these slides to you, but if you think about, we're all champions in this space, I imagine, but we're hopefully asking folks to start conversations from who knows where. We don't typically know where our healthcare providers stand on politics a lot of times. So something to think about.
Can I ask you a quick question?
Sure.
Or maybe a quick two questions. Something you said initially, we're going to kick insurance companies out of Washington state. That sounds great, but what exactly do you mean by that? I mean, literally they can't do business, or they just won't want to do business, or?
So the Washington Health Trust creates a public option. And what the design of it is opt-in, right? So it'll start with any of the Washington state controlled healthcare dollars. So all the Medicaid dollars that are state funds, all the PEB/SEB contracts that are state funds, that's what starts the trust. And then everyone else opts in. It's going to be way cheaper and way better coverage. So over time, the insurance companies will be out because they offer a terrible product.
No.
Let's kick the insurance companies out as like a rally cry. In reality, it's a incremental process based on their inability to compete with the functioning of the Washington Health Trust. Does that make sense?
Yeah. So then, because I have employees, I have to personally deal myself with insurance. So, it's a real headache. I'd much prefer to have something like this. But so that means I'd still be left, or we would still be left dealing with just Medicare and this one and maybe the VA potentially.
Yep. Yeah. It will not interact with the VA at all. It's a separately federal funded program. It'll usurp Medicaid. If the federal government grants waivers for incorporation of Medicare dollars, then that's where we become as close as possible to a single payer system at the state level. It's not necessary for that to happen, for this to function. And Rose Roach, who heads up the labor campaign for single payer, brought up some really good points about why we don't want that, maybe. That Medicare, at the federal level, Medicare's done a lot of good in creating health equity and desegregating hospitals. And if states are allowed to decide how those Medicare dollars are spent, we could see things going in the wrong direction around some of those social justice and racial equity issues in a healthcare space.
I mean, straight Medicare is wonderful, but Medicare disadvantage or whatever they call it is really bad.
Yeah. Right. And so what we would offer is essentially a public, what am I trying to say? A public
Medigap
plan. Thank you, Catherine. Yeah. So there's competition for those Medicare Advantage plans to cover the things that Medicare isn't covering.
Yeah, I'm trying to think what my partners are going to be asking me.
Yeah, please do. And yes, please do. And if those are the things that should be on the one pager, please let us know, because that's really what we're trying to develop is how do we have these conversations.
It also, most people gets rid of all the credentialing. You have to individually credential constantly with every single insurance company all the time. And you have to keep updating your credentials. And it's such, people just think, the billing, but the credentialing is also a huge headache. And they charge you a lot of money to do that.
Yeah, you do it once through Provider One, and that would be it. Yeah.
David's got a question too.
Oh, I can't see hands. Go ahead.
Yeah.
Thanks, Catherine.
Mm-hmm. You're on mute, David.
Always avoid the use of the term public option because it's been bastardized. I look at Eileen Coder. She called what she tried to introduce a couple of years ago a public option, but public option should be restricted. I wouldn't even use the term, but no for-profit private insurance is allowed within the system that Washington Health Trust is going to be setting up.
Yeah.
That's partially true. So the insurance companies could provide things that the Washington Health Trust isn't covering. So, and I think that's similar in Canada. Like if you want a private room or you want a fancy blah, then, that's where you would get supplemental insurances for those things that are not considered essential benefits in the Washington Health Trust proposal.
And I think it's important to remember that, and I totally get it with the public option, but until we get buy-in from a federal government, it has to be a public option initially to get started. And within the language of the trust as it's currently written to try to appease our elected officials who said, oh, this is just too fast. This is too fast. It can't go on. So it becomes the only option once 60% of the citizens are enrolled. It used to be 51%, but we extended it to 60% because they felt it was too fast to slow it down. We're kind of thinking it 51% is probably sufficient. And then in regards to ERISA, there always has to be the ability for ERISA plans to choose not to be a part of the trust. So until the federal government does what they need to do.
Yeah, so nuances, which is why we get feedback around. It's not really single payer. Okay, well, you're right, but it's as close as we can get. So yeah, good discussion. Thank you. So moving on to the ballot initiative. So we are turning our sights towards the initiative strategy now that legislative session is over. We have run 3 initiatives in 2017, 2021, and I gotta move this so I can see 2022. 2021 was interrupted by COVID. The Delta variant shut us down. And then 1471 was like rebuilding connections. I mean, it was rough. So really impressive that we're still collecting 100,000 signatures across the state in really challenging kind of situations. I-1600 had the momentum of, the Bernie movement and those kinds of things behind it. And just, we were brand new, and we've learned a ton. So I think that most of us in the room have one good go at this left, and we're targeting the 2028 ballot. From the research we've done, we know we need to collect about 400,000 signatures over 9 months. That represents an initiative to the legislature. It's the same amount of signatures in less time if we go with an initiative to the people. We know that we need at least $200,000 in the bank to launch. We know we need $1 million or more to make the ballot, and we know it's really expensive to win on the ballot, to get out the vote. These numbers come from research that Andre did around other ballot initiatives in Washington state, both ballot initiatives that have been successful, like legalization of marijuana and those kinds of things, as well as what it costs to defeat those Brian Haywood initiatives that are coming. So, both the costs of winning and the cost of winning a successful no campaign is what's represented in these dollar amounts. We do not have this kind of money, but Michigan took on gerrymandering with their ballot initiative, and they had like 50,000 signatures in the first 2 weeks, and they had their 400,000 signatures 2 months before the deadline because they just had a groundswell of support. They did all of their fundraising through small dollar donations across the state. They had volunteers absolutely everywhere, so much so that the media was, they garnered media attention by just simply being everywhere. So that's what we're trying to build here. We do have regional teams functioning in 10 out of 39 counties right now. Many of these counties are hosting monthly meetings. They're doing tabling events. They're participating in No Kings. They're doing all kinds of stuff, movie nights and all kinds of things, trying to build the foundation it's going to take to collect 4 times as many signatures as we've been successful to collect in the past. They're also connecting with other local organizations that would be in alignment and support those signature gathering efforts. If you want more information, they did just have a regional team leads meeting on the 15th. There is an initiative team meeting tonight. They're doing them every Wednesday now. So I'm not there, I'm here. And so for 2026, Whole Washington is really going to be focused on building a coalition committed to collecting signatures for a 2028 ballot initiative. Whether that's a 2027 signature gathering for initiative to the legislature or a January 28 signature gather launch for the initiative to the people. That decision hasn't been made yet. So far, we have 2 organizations committed to collect with us. Progressive Victory, who had a huge hand in Katie Wilson's win in Seattle, and then the DSA, specifically the Southwest Washington chapter of DSA, has gone beyond endorsing us to a true commitment of collecting signatures with us. So we would love to see more of the organizations in Hicker around this movement commit to collect with us. We're building tools to make it easier to express that interest. We have a pledge to sign campaign, which is an individual signature. We're building a similar commit to collect process. So what can you do? Here's that pledge to sign. If you've got your phone with you, QR code there goes straight to the wholewashington.org/pledge. What this does is put you in our database so that when we go to collect signatures, we can find you. We know that you want to sign it. We will probably mail you a full petition so you can collect signatures from those around you. There's 20 signatures on a page. I collected 7 the first time. So we know that not everybody's going to collect that whole page, but we'll get 7 for the price of 1 or whatever, and then mail it back into us so that we can finish collecting the rest of the page. But this is how we're going to try to get a head start on that signature gathering. collecting 400,000 signatures across the state is really very challenging. And so having a head start, knowing who our supporters are, building those local teams, making the connections with small businesses who can host petitions and that kind of thing is really the work of 2026, so we can be successful. Everything costs money. Thank you. You guys mentioned our gala at the beginning of the meeting, and just there's a thank you on here for PNHP as well for being one of our very first sponsors for this event. So appreciate the support here. There's tickets available. Their early bird prices are happening right now. If you're on social media, we are on them all. Whatever your favorite one is, find us and interact with our posts. That helps us get the notice so people know who we are. The first time I was collecting signatures, I would have to spend a significant amount of time just explaining what whole Washington was, and then what universal health care is, and then why you want to sign this thing. We're hoping to get to a space where they go, oh, whole Washington, yeah, I'll sign that, and that's all it takes. So all of the efforts in all the community organizing we've been doing is really around that name recognition, the recognition of what we're trying to do, and finding our supporters so that we can be successful on the next initiative run. Thomas has been doing a fantastic job of curating different events on our YouTube. Their podcast, another collaborative with PNHP there, as an example, just really great content on the YouTube channel. We also have our training materials on the YouTube channel. So if you've got folks who are interested and have busy schedules and can't make it to a scheduled training, then they're available on the YouTube. Sign up to volunteer, share that with your friends, donate, please, if you want to. We are nonpartisan, and Act Blue is associated with the Democrats mostly, and Anadot is mostly conservative fundraising. So we have both of them to help maintain our nonpartisan status. We are working on a merch store. We've tried to make our website super volunteer friendly so that if you're going to something, you're going to go to a rally, you're going to No Kings, you're bringing whatever, you're doing a watch party on UW campus. You can print quarter sheets or full size and bring them with you. And that's it for me. I would love any other questions, some discussion. Again, I'm hoping to get a little bit from you about how we can do a better job of stakeholdering with providers, both in both strategies, the legislative pathway as well as
we all have our hands up, I think.